Time now for this week's Health Matters. And Lynn, Szabo, PA, on the phone. I've had such wanderlust lately. I've really been wanting to get out and to see the world. It's been so long. And I think maybe today's topic is the closest I'm going to be able to get.
Yeah, probably for a while. But it's an interesting topic, considering there's like 164, I think was the latest number I saw, vaccines against COVID that are either kind of being created or are actually in production and in people's arms around the world. We only really know about 3 of them, maybe 4 if you count AstraZeneca.
Wow.
So Pfizer, Moderna, J&J, and AstraZeneca is kind of the limits of our reality. But so what is the rest of the world doing? Because actually a lot of parts of the world have been immunizing right along with different vaccines, and unfortunately a lot of parts of the world have been getting no vaccine.
Right.
So yeah, and it's important that everybody in the world gets vaccinated, because if we're not using effective and long-lasting vaccines, then the rest of the world becomes kind of a reservoir, and this disease will be with us way longer than we want it to. So 2 interesting vaccines, one in China, one in Russia. So kind of interesting vaccine strategies too. So we'll get into that a little bit. But what is China doing? So China's vaccine is officially called the CoronaVac, but it's more commonly known as the Sinovac. It has past approval in China and is distributed to other countries by way of China. And this is kind of interesting. It's an inactivated virus. So they took the whole COVID virus, they chemically inactivated the viral RNA, and then they used what's called an adjuvant chemical, which in this case is aluminum, to boost the immune response.
Wow. Okay. So
way different from ours.
But is that like I mean, that's kind of how vaccines are made in the past, right?
Right.
Yeah.
And they did get theirs out pretty quickly. I think theirs was out by like November or December of 2020. This one's easier to handle because it doesn't have the low temperature requirement.
Okay.
But the efficacy is kind of crummy. I guess it's good for the things that you want it to do the most, though. So it's 50.7 efficacy at preventing symptomatic infections. But overall 83.7% effective against cases that require treatment, and 100% effective against severe cases and fatalities.
Wow. I mean, and that 100%, I mean, that's kind of the goal of all the vaccines, right? It's not going to keep you from getting it, but it'll keep you from dying from it.
Yeah, or to need any kind of maybe extensive medical treatment. So that's good. If you can dodge the event, that's probably good.
Yeah.
And it doesn't really hold out any great benefit for the variants of concern. I know it was put out really early, and it was pretty much addressing the native COVID, the wild type COVID, I guess you could call it now. So it was in arms before variants of concern started to show up. And my guess is it's probably not super easy to pivot like the messenger RNA. Vaccines are really relatively easier to kind of have them directly address the changes that show up in the variants of concern, but this one isn't. So kind of the first thing China did was vaccinate their troops, which is kind of interesting.
Yeah, right.
Yeah. And then this is also interesting. They started exporting it to Brazil, Southeast Asia, Mexico, and Turkey. And I think it's possible it's the dominant vaccine in Mexico right now.
Okay.
But really, it's definitely the dominant vaccine in Southeast Asia. So if you're, I guess, living in, I don't know, Indonesia or something, and you got vaccinated against COVID, it was likely this vaccine. So that's kind of interesting. But the use has been politicized, especially in Brazil, where it's preferred over the messenger RNA vaccines.
Wow. Okay.
Yeah. Brazilians, I guess, have gotten I would say, corrupted message that the messenger RNA vaccine is something to be suspicious of, but this more traditional vaccine is what they really want to have in their arms, even though it's not not even close to being as effective.
Yeah, yeah, exactly. But I mean, we've had that's a thing that's a prejudice we have to overcome in the United States as
Right.
well. People are not
Absolutely.
have a hard time getting their minds around the mRNA vaccines.
Right. Yeah, and yeah, not going to mess with our DNA. There's no way it could possibly do that. But
Hmm.
it kind of sounds a little scary, but it isn't. It really isn't. It's quite elegant. It's been around for a while, and it's really easy to change if there's a variant of concern that needs to be addressed.
Right.
So these
So
guys not as lucky though.
so the Sinovac, you're saying it cannot address different variants.
It hasn't really given a benefit to any of the variants of concern. And my guess is from how they make it, it's not easy to pivot to address a variant of concern if they needed to.
Okay, so but what do you mean by the sentence it hasn't given a benefit to the variants of concern?
That means it's if somebody was interested in super protection against the variants of concern, this vaccine would not offer it.
Gotcha. Okay, thank you for clarifying that for me.
Yeah. Yeah, so I do know about immunizations a little bit in China because I worked with somebody a long time ago at North Country Clinic, and this person was a Chinese national who was in the United States working, and he talked about immunizations. He had 3 kids here, and he talked about the difference between immunizations in California, where he was living in Humboldt County, and how they immunize kids in China.
Hmm.
And so he was of the opinion that it was unfortunate that the United States didn't take immunizations more seriously.
Hmm.
Yeah, kind of
Yep.
interesting, huh? And he said that in China, and I'm talking about childhood immunizations, but I wouldn't be surprised if this is similar now with getting immunized against COVID, is that I don't even know if you get a heads up, but one day a certain neighborhood is kind of like cordoned off with authorities, and they send the nurses and the doctors or whoever their medical providers are in with immunizations, and they line up every kid and anybody who needs them, and they just immunize them. So no parental real, I guess, no parental involvement in
Hmm.
deciding, and no real say even when it happens. It just kind of, it's your neighborhood today. I don't even know if they get very much notice, he said.
Wow.
He's,
Wow.
yeah, he said they just line everybody up. It's kind of like in the old days. And they used to do that to us here in school
Hmm.
and impact everybody, but it's a little bit more forceful, I think. And so he was advocating that strategy in immunizing because I guess his feeling was that as a public health issue, it was more important that the individual rights be kind of compromised for the good of the whole.
Yeah,
So,
there's a massive debate around that whole. I'm not even sure how I feel about all of that, but yeah, yeah. I mean, that's the way to do it. Immunization really works
yeah,
best if everybody's immunized.
right.
And then,
Totally. And they have kind of a different situation, huge population densities compared to
hmm,
what we have. No real expectation of prioritizing individual rights. And at that time, now this was in the early 1990s, this was before the concern, which is not a concern, about autism associated with childhood
hmm,
vaccines.
hmm.
And he, as a parent, just felt like it was efficient. He saw as that it as important for this, stability of the community and super efficient.
Yep.
And I was sitting there horrified. As a new mom, I was kind of horrified. But
Oh man.
yeah, our kids arrived at the same endpoints, though. Our kids basically had the same immunizations,
Hmm.
in the kind of similar ages, and to protect against all the same diseases.
Right.
So, kind of interesting.
And I think those are all questions and debates that certainly we're going to have to wade, and not just wade, we're going to have to dive right into those because moving forward, is there's what, 7.5 billion of us on the planet right now. We are just
Right.
going to we're going to become more elbow to elbow, and ideas of individual rights balanced against community well-being. Yes, those are tricky questions, but they will need to be
Right.
addressed. They will certainly need
Right.
to be addressed.
I imagine risk benefit too, because the population density where he was living in China is
Hmm.
not the same as, and he mentioned that was not the same as he was living in early 1990 Humboldt County.
Yeah, a little different, right?
Yeah, kind of different. So that's the Chinese situation, kind of interesting. I think it's very clever of them, though, to export the vaccine, you know, to so many third world countries and developing countries.
Hmm.
I think that's very, very clever, and I think it might even be a little scary, but
China across, okay, so this is across the board. China is kind of working in that non-aligned space, or what would have been back in the Cold War, the non-aligned space. They're investing heavily
it,
in Central Asia, in Africa, in South America, because they're just building up their own infrastructure where it's cheap and easy to do that. And so yeah,
right, exactly.
yeah.
And you might say maybe that's penance for having, brought this virus to us, but I don't think so. I don't think their motives are that pure.
Yeah,
I,
no.
yeah, I,
No
so
more, no more pure
interesting,
than no more pure than ours would be in the exact same situation.
totally. But
Yep.
also, I've asked a couple people that I work with who have children who are in the armed services, young adults, I guess
Hmm.
we shouldn't call them children, in the
Right.
armed services. And they're saying that they're not necessarily, as people, members of the armed services, immunized for COVID yet. So it's interesting to me that China also prioritized its army, its
Mm.
armed services,
Hmm.
and
Hmm.
and it doesn't, with my small sample size of like two, it doesn't seem like that's happening here, and I kind of wonder why.
That's
Anyway,
interesting. Yeah, I don't know. I know. Yeah, yeah. Like we talked about. I mean, prisoners in prison have been vaccinated or offered the
right.
vaccines, and. But yeah, that's interesting. And there's a whole bunch. I had a Chinese friend years and years ago who would explain to me the Chinese mindset that kind of explains why, why the military might have gone first, and that is that they have a long, long history of war and people coming in and waging war. And then on top of it, the
Uh-huh.
modern state has a long history of sort of top-heavy repression or at least control. So yeah, the army becomes a very important part of their society and their community cohesion, if you will.
Well, hoping for the best and kind of expecting the worst on that, but
Yeah.
I thought that was interesting. So the next one is the Sputnik V, and supposedly it looks like if you when you write it out, you have, I suppose what's pronounced Sputnik, but I'm American, so Sputnik, and then what looks like a Roman numeral 5.
Yeah, yeah,
Uh, so I guess most of us would read that as Sputnik 5, but
yeah.
it's actually the V is a nod to Vladimir Putin,
Oh my God.
supposedly.
Serious? Oh
Supposedly.
no.
I know. I know. It's yuck. Anyway, so this Russian vaccine was okayed in early September 2020. So there was a little bit of, I think, a little bit of kind of, who's going to get the vaccine out first, Russia or the United States?
Mm-hmm.
And so Russia got theirs out in early 2020. And
Or
it's
September.
it started being used in multiple countries, and also the United Arab Emirates, and for some reason Argentina.
That's arbitrary. I wonder why that is.
Yeah, I don't really know.
Hmm.
I'm sure there's underlying political strategies here, but I don't. That one's not super clear.
Yeah, yeah.
But
But
um,
certainly, so like the former parts of the Soviet Union, so Central Asia, East Europe, things like that.
right.
Okay.
uh And I'm not sure why they picked Saudi Arabia or Argentina. That seems kind of random. But so this is a clever vaccine. I wish it would do better than it did, but it's still pretty good. So it's a two-vector vaccine. So they take two human adenoviruses, and they include a gene on each of those that encodes for the full length of the spike protein.
Okay.
So the messenger RNA vaccines that we're familiar with
Mm-hmm.
are only a tiny part of the spike protein. This encodes for the full length of the spike protein.
Okay.
I think that's very clever. So the adeno 26, it's adenovirus 26 and adenovirus
Okay. Hold on. I'm
5
sorry. So very clever, just because it might be more adept at dealing with variants because it's dealing with a
variants
longer
of
genetic.
concern.
Gotcha. Okay.
Yeah, I think that's what the attempt is here, because a small a small variant could take out the whole messenger RNA,
Mm-hmm.
but a small variant, a small change is not going to take out the whole spike protein.
Exactly. Yeah. Yeah.
So I think that's clever. So it's two doses you get 21 days apart. So the first day you get the first dose is the adenovirus 26 based vaccine.
Mm-hmm.
And then on day number 21 you get the adenovirus 5 based vaccine.
Okay. So you've got basically then, instead of it being two doses of the same vaccine like we're getting with Moderna and
Right,
Pfizer, you're getting
right.
two different vaccines in essence, right?
Yeah, there's actually two carrier molecules.
Okay.
One is adenovirus 26, one is adenovirus 5.
Mm-hmm.
I'm not sure. I'm not exactly sure why they did that, except maybe if somebody has, antibodies to adenovirus 26, you can solve that problem by giving them adenovirus 5
Yeah,
and
but
vice
then
versa.
the
But
implication seems to be, or the inference would seem to be, that you really only need one of these. They're just like hedging by giving you
right,
both.
right, and I'm not sure that it might be more eloquent than I'm, trying to guess,
Mm-hmm.
but I thought it was interesting. So there's a 91.6 efficacy response rate, and side effects are really mild, which
Wow.
is kind of cool. Considering that's a human adenovirus, I would have thought that side effects would have been a little more intense,
Mm-hmm.
but they say they're really mild. But there's some concerns that the vaccine efficacy data was based on tiny sample sizes. Like
Mm.
one of the numbers I saw was 9,
No.
and the other N was 9. Um,
Yes, but they were nine big people. Does that help at all?
right,
No.
that's right. And there was a sketchy statistical analysis. So back in September 2020, I remember when this came out, and most of medicine went sketchy,
Right. And
really
and
sketchy.
the medicine might have done that on medical things, but I think people just went, "Oh, Russian, sketchy." That's what I
Yeah,
was thinking.
right. But it seems to be working.
I'll be
So it's
damned.
stable and easy to store, and it's low cost.
Mm-hmm. Mm-hmm.
So, like I mentioned last week, Russians receive a text message advising them when they're eligible to get vaccines, and we thought that was creepy.
Mm-hmm.
But I got a text message, in the last week from my turn in California saying I'm eligible, although
Yeah, there you
I was vaccinated 3 months ago. So, but I think it would be really kind of weird since pregnant women and people who are recently ill with a cold virus can't get this vaccine.
Hmm.
So I think what would be weirder is if you got a text message that said, no, you can't get your vaccine because you recently had a cold, if
Oh
they would know
wow.
that. So
Yeah.
that, yeah. But now, this one's commonly used in parts of Africa and Central to South America, so it's pretty common. So, anyway, that's kind of what's out there, what the rest of the world is getting. I do know that I noticed in the news in the last couple of days that the United States has bought up some AstraZeneca vaccine
Mm-hmm.
that comes out of Oxford in England. They've had some problems with it. It also might have a small chance of the blood clot, similar to the Johnson and Johnson vaccine.
Yeah.
Um, and since it's not available in the United States, that the United States kind of hedged its bets by buying up doses of vaccine, they're going to be sending it out to other countries who actually can use it.
I
And I
think
think that's
I saw
pretty smart.
I saw just today that they're sending some of the AstraZeneca to India, where things are going crazy right now.
Yeah, things are blowing up there. Poor
Mm-hmm.
India.
Yeah.
Yeah, they've got a lot of badness to deal
Yeah.
with.
Yeah.
Yeah, those doctors and other healthcare providers are deciding who lives and dies, and I
On
imagine
on the
horrific.
street, they're deciding it, because you can't even get it.
Yeah,
People are trying to buy oxygen just to have themselves, and yeah,
right,
it's just horrifying
right.
watching those reports.
It is. It's probably as bad as anyone could imagine.
Mm-hmm. Mm-hmm.
Um, other news, kind of little aside facts about Johnson and Johnson. The first man, age 30, out of San Francisco,
Mm-hmm.
was diagnosed with a blood clot in his leg from
Hmm.
that I think is related to a Johnson and Johnson vaccine. So there's been 15 women, probably out of between 7 and 8 million doses. 15 women got clots, and now this one man um, got it.
Wow.
So it's still a really, really rare side effect. You can still get clots from the disease at a much higher rate. You can still, other vaccines actually still have the clotting issue. The AstraZeneca has been looked at for this, probably one of the reasons it's not okayed in the United States, because I think actually the incidence of clots for that vaccine is a little bit higher.
Wow. So
Yeah.
how prevalent would a side effect like that need to be really to mean something? Because I mean we spoke last week about this where, the pause for the J&J vaccine, it was basically to let healthcare workers, let medical people come up to speed on what they should be looking for and how they should treat this, but it was also to kind of give the public a pause to take a breath and calm down about stuff. But
Right.
how? And you were saying, I mean, at that point when we recorded it, it seems like they're higher numbers now. But you were saying something like 6 or 7 women out of
Right.
7 million doses administered. How
Right.
how many people need to be affected by the clotting issue for it to really statistically mean something as far as the efficacy of the vaccine?
I think that depends on what the risk of the disease is in any one individual population. So I don't think it's possible to answer that with the data that we have.
Mm-hmm.
So maybe if somebody was in the middle of India, in a really horrific situation, I
Yeah.
would think that the risk of the vaccine, the benefit of the vaccine would hugely overwhelm any kind of risk.
Right. Right.
So if somebody was in Del Norte County and, had other choices and nobody they knew was sick and they were wearing their masks and following other social distancing guidelines and washing their hands and things like that,
Mm-hmm.
I think it would be a whole different world.
Mm-hmm. Mm-hmm. Yeah,
But
you're
they're
right.
still saying from the CDC, and Fauci has said this too, that the best shot is the one you can get in your arm the fastest.
There you go. Yeah.
Right. But it seems here, it seems like Moderna is really, really available here.
Mm-hmm.
And right now, what I'm noting in the UIHS vaccine clinics is that people aren't showing up for their second shots.
Mm.
And there's a way reduced interest. And right now, we've immunized all the elders,
Mm-hmm.
right?
Mm-hmm.
So all the people who were probably ill and had comorbidities to consider. And so most of the people who are expressing less interest are younger people, maybe people who have already had it and didn't think it was such a big deal and think they aren't at risk again, but
Mm.
they are, and it can be worse the second time around. So I think it depends on risk benefit. You don't really have the data. So your question might be, when is the FDA going to pull it completely?
Right. Right.
Like what numbers do they need for that? I have no idea. I couldn't really tell you.
Yeah, it seems like there's just a whole panoply of different variables and relative concerns and risk benefit analysis that need to be made. So yeah, it's not just a
Right.
hard and fast, this many people and then we'll pull it. Yeah.
Right.
Okay. Well,
So
again, and like you say, like where you are determines determines that cost of the risk that you're taking. So it's once again, it's just paramount that you make an informed decision. So you just know as much as possible.
right, right. And they now have educated the healthcare providers, and I think we know how to recognize this pretty well, and I think we know how to treat it
Mm-hmm.
in ways that are appropriate to the problem.
Mm-hmm.
Um, so I, especially, I would think if I was male and I was under some pressure to get immunized, and I didn't really have a choice except for Johnson and Johnson. That was the quickest, most available choice. I'd
Mm.
probably move forward without any pause.
Yeah. Yeah.
So, and the one thing that has to be said about the clots in women is the clotting mechanism is different than the clotting mechanism that can be associated with combined oral contraceptives, or otherwise known as birth control
Mm-hmm.
pills.
Mm-hmm.
People are getting all excited that it's the same thing. It's not.
Yeah.
It's not the same problem. It's treated completely differently. The risk is um, still pretty low, but it's not that women were on birth control and that's why they got the clots. It's not that straightforward.
Okay.
So,
Okay.
okay.
Wow. Well, thank you. And I know you've already sent me the email for next week. What's the topic for next week going to be?
Compassion in healthcare, because it's certainly become apparent the last year that we really need this.
Mm-hmm.
So not only from the provider point of view, but also from the patient point of view. And I happened to be listening to a Freakonomics podcast that was actually addressing this.
Mm-hmm.
And I thought it was worth talking about because it's kind of a problem up here. And it's kind of a problem right now. So,
Okay.
yeah.
Excellent. I look forward to that. That's an interesting topic. Yeah. Yeah. Cool. All
Yeah,
right.
it might be the first directly un-COVID one
It's
that I've had.
we did one for some reason last summer that wasn't COVID, and then we're right back into it. So yeah,
Yeah.
this breaks a long streak of COVID health matters. So yeah, that'll be
Yeah.
interesting. That'll be a refreshing discussion. That's cool.
It certainly COVID has made it more acute of a problem.
Okay.
So,
Okay.
yeah.
All right.
So
Well,
there's that. Anyway, yeah.
all right. Well, Lynn Szabo, thank you very much for all of the knowledge and the skinny on what's going on with the rest of the world and their vaccines. And we look forward to our discussion next week.
Thank you.
All
Talk
right.
to you then.
All right.
Bye.
Thanks.